had a few moms recently on this channel request a video about what happens to the baby after they're born, specifically in the hospital, which is such a great question. And I'm shocked I haven't made a video like that before. So here it is. Bear with me, I'm having horrible pregnancy brain, so I'm going to be referencing the list I made about all the things so I don't forget anything important. Okay, so baby comes out. Ideally, the umbilical cord can finish pulsating before it's clamped and cut. If baby is in distress, if they need any special immediate medical attention, typically the cord is clamped and cut right away, and the baby is moved to a warming table where typically a NICU team will care for them. A lot of times this can happen in the labor and delivery room. So that's if baby's in distress, but more often than not, they come out. Ideally, they're placed right on your chest, skin to skin. Sometimes they need a little bit of stimulation. So maybe the care provider will kind of like rub them with the blanket a little bit. If it seems like they're having trouble breathing, they might use the bulb syringe to suck out any fluid from their nostrils and their throat. And then from there, for a while, like they just hang out with you. And actually pretty soon after the baby is born, the care provider is going to do an assessment of them to give them what's called an APGAR score. A lot of times this can be done when the baby is with you. I think with my son, they just did this while he was on my chest. And so with this APGAR score, they are testing the baby's breathing, their heart rate, their muscle tone, their response to stimuli, and their skin color. And just know that a lot of times right when the baby comes out, it can be pretty normal for them to be like blue or purple, but their skin tone should even out pretty soon after they come out. So that's something that the doctor is looking at. Like, is the blue or the purple slowly fading? And so they'll give the baby a score from 1 to 10. Ideally, you want a 10. And then a little while later, this doesn't have to happen immediately. Baby is measured and weighed in the room. And with measuring, I mean, they like lay them out flat and they like literally measure to see how long they are. A lot of times this can be done in the labor and delivery room as well. If they're saying they want to take the baby somewhere else to do that, usually you can request to have a scale brought into the labor and delivery room so baby does not have to go anywhere. A couple hours after they're born in hospitals, at least in the United States, babies are typically given this like goopy antibiotic, these goopy antibiotic eye drops. And these eye drops are given to babies to help prevent any harm from any potentially harmful bacteria they might have been exposed to coming out of the birth canal. This is especially important like if the mother has chlamydia or gonorrhea, because sometimes if the baby's exposed to that, it could cause blindness. So a lot of times it's like a just in case kind of thing. It's not like if the baby doesn't get the eye drop, something horrible is going to happen, but it's protocol in most hospitals. And the eye drops don't hurt the baby or anything like that. But I typically tell clients, if possible, like ask them to just wait a couple hours, because from what, and you can confirm this with your care provider, from what I've heard, these eye drops just need to be given within the first 24 hours after birth. So waiting an hour or so isn't a big deal. And I just make this recommendation just so you and the baby can have time to bond before their eyes get all, because their eyesight is already not great when they are first born. And then these eye drops make everything like real fuzzy. So I just like moms and babies and partners and babies to have time to make eye contact to bond before the eye drops are applied. All right. They're also given vitamin K orally or via a shot, and vitamin K helps with blood clotting to help to prevent any internal bleeding. The baby's footprints are taken, usually like the footprints, that happens like after you've been transferred to the recovery room. Obviously that doesn't need to happen right away. They'll also have you fill out the paperwork for the birth certificate. So that's when you'll be filling out your name, your partner's name if you have a partner, the baby's name, all that fun stuff. And then in a lot of hospitals, about 24 hours after the baby is born, they do this like heel prick blood test, and the babies don't like it because they like literally, the nurse pricks the back of the heel with usually like a needle, or I can't remember if they have like a special device, but essentially they're like pricking it. So blood will come out, and they have this piece of paper and they need to get blood droplets on, I think, like 5 different spaces. And then the blood is tested to see if the baby is at risk for certain medical conditions. And I'm sure this is something that parents could choose to opt out of, but I'm sure you'd have to sign a waiver. So this is just kind of like a general list of what to expect for the baby after they're born. Of course, if they have special medical conditions, there's going to be more. You know, if baby has an infection, they might need to go to the NICU, they might need to get antibiotics. In regards to breastfeeding, if you're choosing to breastfeed, you and baby will receive support for that. And you know, if you're curious, which, you know, we should all be, I suppose, ask the hospital, you know, specifically, like, can you give me a rundown of what I can expect to happen to the baby after birth in the hospital? All right, if you have any questions about this, or something happened to your baby in the hospital that I didn't mention and you think would be helpful for other parents to know, please let us know in the comments below.